I hate my dentist. How many times have you been asked about your occupation in a social outing and you hesitated to say it? Because you've always been told that people hate their dentists. The irony is, once they know you're a dentist, they spend the rest of the outing asking about the problems they have with their teeth. Think about it. I don't really blame them, because in fact, I myself hate going to the dentist too. Did you know that by studies, we are one of the top 10 hated professionals worldwide? Although we're one of the most needed, most people feel afraid of us. This thought made me think of us, the dentist. What are we afraid of? Do you remember the excitement you had with your first aesthetic case? A perfect case to post on your Facebook or Instagram page. Paying attention to the fine details in all the steps, starting with a wonderful wax up sent by your lab that blew you and your patient out of your minds. The meticulous preps, the perfectly positioned implant, the time spent in gingival retraction, the repeated impressions, the number of times you personally went to the lab technician by yourself, seeing all your effort and time presented by that wonderful ceramics on a cast, to the extent that you fight the desire to take a selfie with that gorgeous cast. Then comes the moment of truth, the day of delivery, the day both of you have been waiting for, the day that you are the patient's hero. It's a moment to make the perfect before and after post. Unfortunately, with most of you, the scenario does not end that way. You hand the patient the mirror, and then there's that moment of silence. The patient is not happy, and only one question revolves in your head. What went wrong? It was all perfect. Everything was done by the book. So many questions come streaming in your mind. Is it because I didn't pull the gingiva in mind? Or is it the implant? I was so sure that it was perfectly positioned in the bone. Why isn't the restoration fitting in place? Or is it because I didn't think about occlusion? But who actually does think about occlusion? No one understands it anyway. Is it going to be one of those other chronic cases that no matter how many remakes I do, the patient is going to stay dissatisfied with how they look? Or keep complaining that they can't bite comfortably? Or complaining of gingival problems, cracked or loose restorations, or even worse? Then sadly, you start doubting your skills and knowledge. And instead of taking your steps towards success, you're stepping back, feeling disappointed. This is what most of us are afraid of: patient dissatisfaction. We've all been there. This is exactly what we were taught in our universities. The additional learning through the years, the seminars, courses, and workshops we attended to make us that perfect aesthetic dentist. But the fact is, it's not our fault. There are more recent and predictable ways of dealing with aesthetics that most dentists are not fully trained on, with very high success rates: the digital way. The only reason that you were surprised with all these problems on the day of delivery, when it was too late, is because this was the only time during the whole treatment process when you were able to see the whole picture and relate the final result with the patient's teeth, gingiva, bone, and whole face. Just imagine if you were able to truly visualize and relate all these structures with the final results in 3D through a digital workflow, before even touching your patient, and weigh between the aesthetic, biological, and functional issues to attain a foolproof treatment plan that links all the dental specialties, including your lab, to be precisely executed on your patient's mouth. The digital workflow is the key to success for any full mouth rehab aesthetic case. To upgrade yourself to a modern digital dentist, you need to learn and link between the three pillars of digital dentistry: visualize, plan and design, and then only should you execute. We've collected the years of our experience in digital dentistry in a series of 4 webinars available for you for free. Click on the link below to access your free digital masterclass.